Hello, I am Dr. Rajkumar Wadhwa, Chief Gastroenterologist at Institute of Digestive Sciences, Apollo Hospitals, Mysore. Second wave of pandemic has devastated us all. We are affected either directly or indirectly in one way or the other. This also has brought to our notice that this virus not only affects the respiratory system but other organs as well. Gastrointestinal symptoms, one of the major organs of the body, is affected. It is generally believed that about half of the patients at one point or the other of Covid-19 will have gastrointestinal symptoms. Does this have any significance? Yes, it does. Then how do we understand what significance these gastrointestinal symptoms bring to us? And what are the symptoms that we are affected with during COVID-19 due to gastroenterology? We need to understand that COVID-19 is a virus. It enters the respiratory system and other organs through a receptor. These receptors are present inside the intestinal cells. Virus enters through it, multiplies, destroys the cells and produces the substance which are called as cytokines. It also enters the blood vessel from the intestinal cell, which carries it to the liver. Thereby it attaches to the liver. It also has a capacity to affect the nerves which supply the intestine. And hence we get the symptoms which are very common, like loss of taste and smell, nausea, abdominal pain, diarrhea, and uncommonly bleeding from the intestine. It is generally believed that diarrhea is present in as many as 1/3 of the patient. Usually it is mild and lasts for up to 2 to 5 days. Is there any significance of these symptoms present when we are worried about the respiratory symptoms? Yes, there is a significance. It is generally believed that if your intestine is getting affected, then you have a larger viral load inside your body. That means that there is a possibility that you may have a higher amount of complications or severe diseases as far as the respiratory system is concerned. In addition to that, there is a potential new form of transmission of this virus from one person to another, because it is generally believed that this virus is shed in our poop. And this can happen even before the symptoms start. Not only that, in about 1/4 of the individual, the virus can continue to shed for up to 3 weeks. That is, even if your respiratory symptoms has stopped shedding the virus, you can continue to lose the virus in your intestine. That means your near and dear ones have a potential to get infected with the virus even after you have recovered on the respiratory symptoms as far as the virus is concerned. How do you prevent this? Of course, prevention remains universal. Washing hands again and again, covering your face in mask, and if possible, have to have the patients who have already COVID-19 at least for 2 to 3 weeks should separately pass the stools in a different toilet than as compared to the rest of the family members. There are a lot of areas which are still unclear, and as the time passes and we understand the disease better, we will be able to give a much clearer idea as to how this plays a role in significance of the diagnosis and treatment. However, it is very important to note that about 1/5 of the patient may present initially with intestinal symptoms before even the respiratory symptoms start. So in pandemic, do not ignore if you have an abdominal pain or if you have diarrhea. This may be due to COVID-19, and get yourself tested. Can other organs of gastrointestinal tract get affected? Yes. Liver also gets affected because of the viruses, especially for the patients who have a pre-existing liver disease can get affected. Pre-existing stable liver disease can get decompensated, or symptoms can develop in the form of swelling of limbs or increasing abdominal distension with those who have been affected with coronavirus. Fortunately, post-liver transplant patients do not have a different outcomes because of the COVID-19 as compared to the general population. But we need to understand COVID-19 has created a havoc with our mental health, and there is an increasing incidence of alcohol consumption due to lockdowns and various other and loss of jobs. And that itself can precipitate or worsen the pre-existing liver diseases. We are also taking a lot of medicines because of that. These also can affect the liver and cause damages. So, while coronavirus remains a respiratory virus, GI symptoms are very common in them, and we have to protect ourselves both from respiratory and GI symptoms. Take care of yourself by making sure that you take all the precautions of wearing mask, maintaining social distancing, washing hands again and again. Thank you.